This is NTV.
A very good morning to you. It is 6 minutes past 8, and of course that tells you that this hour it's all about your world. And welcome to the show. My name is Winnie Lubembe. So much to discuss within the next hour, so you want to stick around until the end of the show. Today it's all about STIs and of course the impact that has on our reproductive health and of course just health really in general. Of course today we'll have a special emphasis on a conversation that has dominated the social media spaces over the last week, and that is since the story broke out on the spread of super gonorrhea, especially here in Nairobi. So of course we'll be talking about it a little bit, what brings about the resistance and what is it that we need to do, number one, to be cautious, and also number two, to halt the spread of the same. So of course you want to stick around. We have a gynecologist. He's not so new to us. We have Dr. Johnston. Let me get the name right. Miheso. I was about to call you someone else's name. Dr. Johnson Miheso, who is a consultant gynecologist, is here with us. It's so good to see you this morning.
Thank you.
Happy New Year. We've not seen each other, since the beginning of the year, so it's not so late to say Happy New Year. And thank you really for sparing your time to come and just talk to us about STIs, reproductive health, sexual health, and how important it is for us to have all this information. But again, before we start the conversation, remember, again, like we said, social media was thrown into a frenzy. There were so many terms that were coined. A lot of this, photos actually dominated people's WhatsApp groups, all right, and their statuses as well. All right, what exactly are we talking about? Take a look at the story, then we'll come back with more on the same.
The pleasures of life seem to be inevitable now more than ever. And in the event you happen to dip your feet in the everyday pleasure, strap up. The increase in sexually transmitted diseases, let alone HIV, has seen experts raising an alarm urging Kenyans to put their health first. This comes as the Kenya Medical Research Institute, KEMRI, discovered a drug-resistant gonorrhea, which is possibly in circulation.
And we took 379 women. We swabbed them. Then we took the swabs to our lab and we checked what sexually transmitted infections they have. Amongst other infections, we found gonorrhea. For gonorrhea, we found it in 24 people out of the 379, so just below 10%. Now, we took that gonorrhea from the 24 people and tried to grow it. We had like more than 17 antibiotics of various families, and then we exposed that gonorrhea to the 17 antibiotics. We found one case of gonorrhea that was not responsive to any of the antibiotics we had.
According to the Africa CDC, gonorrhea is a sexually transmitted disease caused by Neisseria gonorrhoeae, also called gonococcus. Gonorrhea causes an infection in the genitals, the rectum, and the throat. According to KEMRI's research, majority of those who tested for gonorrhea were aged between 38 to 48 years.
If you are a man and you catch gonorrhea, first you might have some itch there. Then you might have some pain in the urethra. Then you might have some pus coming out. Then if you don't take medicines, after like a day or 2 days, then the urethra might block. If it blocks, you may be unable to pass urine. If you are a woman and you get gonorrhea, many times, often, you will not have any signs or symptoms. This is not nice. It's better to have signs or symptoms because if you don't have, you could give another person gonorrhea and they don't know. Now, some women will have signs and symptoms. The the urethra will be infected, then maybe at the tip like so, it will have some redness and you might have a discharge hapo. The cervix of the uterus may be infected and then it will look a bit messy there, so on. But the issues start coming when the gonorrhea climbs up to the fallopian tubes.
Researchers say the drug-resistant gonorrhea is worrying due to the lack of a cure, further urging Kenyans to take precaution, as gonorrhea, if gone untreated in due time, would result in infertility.
Case out of 24. But that case, although it is just one, is very important, because what are you going to give that patient? What if that person goes and has sex with another person and gives them the same? What are you going to give them?
Among some of the signs and symptoms of gonorrhea include inflammation in the cervix among women, inflammation in the urethra, a swollen penis, past discharge, and irritation while passing urine. Helen Aura, NTV.
All right. Thank you very much, Helen Aura, for that. And of course, let's just get to really understand, and especially when it comes to the numbers, what exactly does, the statistics say? And this is as far as STIs in general. But of course, like we said, we'll be focusing today on gonorrhea. So according to the World Health Organization, listen to this, more than 1 million STIs are acquired every day. All right. And this is worldwide. And of course, the majority of them are asymptomatic. All right. What exactly does that mean? Of course, Dr. Miheso will help us with the same. But really, 1 million every single day. Think about it for a second. All right. And then, of course, continues to say that more than 500 million people between the ages of 15 to 49 years have a genital infection with herpes simplex virus. All right. Then we also have the fact that STIs have a direct impact on sexual and reproductive health. Again, something that we'll be delving deeper into today's conversation. Drug resistance. This is a major threat to reducing the burden of STIs, and this is across the globe. So it's not only a Kenyan problem. This is a global problem, and we have 4 different types of curable STIs, and that includes syphilis, gonorrhea, chlamydia, and we also have trichomoniasis. All right, but again, what is it about this super gonorrhea that is bringing a lot of headache and concern right here in the country? That is what we'll be talking about in a moment. Now, according to, again, the same WHO, and this is in 2020, WHO actually estimated that 374 new infections of the 4 STIs, right? So the first one is chlamydia, which again, the number stands at around 129 million. And then we have gonorrhea, which is the second one, right? At 82 million. And then we have syphilis at 7.1 million. And then we have trichomoniasis at 156 million, all right? Very, very high numbers, to think about over there. So, Doctor, I'm just going to start with that. All the statistics. What do you make of them?
I think what they're showing is that STIs are very common. Yeah. And good thing is that they are preventable. Mm-hmm. So the trouble we have with the major 2, chlamydia and the gonorrhea, is that they are asymptomatic in most of the women. Right. About 75% of women actually is asymptomatic. All right. And half of the men, 50% of the men. Mm-hmm. So they tend to pass on before they are recognized. Yeah. So efforts would be actually made to sensitize people to start screening before they enter a new relationship, or discuss STI screening more frequently, even in a relationship, so they can keep checking that every time.
Yeah, I mean, and when I was reading, the whole question about, and especially for gonorrhea, right? It's not new, and especially when you're talking about the drug-resistant type, like in around 2020, 2021, some countries actually reported the same, but in the country is when, just recently, after the study by Kemri, is where everybody's like, okay, wait, what is going on? What is happening, right? Something is happening. Yeah. I mean, what do you make of the statistics, especially here in the country with the new drug-resistant gonorrhea?
I think this is a worldwide problem, actually, so it was just a question of time before it gets here. Right. And I think we need to be more watchful now that we know that it exists, actually. Mm-hmm. Trouble with the most bacteria is that they actually learn to evade the common drugs we use. So over the years, every time we subject it to repeated antibiotics, over time it learns to escape that antibiotic. Yeah. So we'll have to be dealing with this more frequently, actually.
Yeah.
And then our trouble is that we actually don't do a lot of testing. So that's something that we need to talk about as well.
Yeah.
That we need to test and give the appropriate antibiotic rather than misuse the antibiotics. Over.
I mean, listen, we just go to the nearby, you know,
and describe what you're feeling, and then you're given antibiotics
and then
by somebody who's not trained.
Yeah. But at the same time, we also have a big issue when it comes to self-medication. You know the antibiotic that you used last time, and then you
take a few of those, 3 or 4 of them.
Or you don't even complete the dose, right? And then you think you're done with the infection, but really, you know, that is not the case. All this again contribute to the whole question about the resistance, which again will focus more on the same in terms of then do they look different in terms of the presentation, or is it still the same? But just in case someone is sitting here and thinking, okay, fine, maybe we're scared to all about gonorrhea, and you know, I don't know who is most at risk of either contracting, you know, or spreading the same. Let's just take a look at some of the people who are more at risk of contracting or transmitting.
So I think it's good to recognize that anybody can be at risk of getting the infections, sexually transmitted infections. So the people at the highest risk are those people who are having sex without protection, so unprotected sexual intercourse, people with multiple sex partners, and then the younger people are more at risk. And then people who have had a previous infection, STI, or who have a different STI. So if you have a gonorrhea and you are likely to get another one, talk about HIV, talk about chlamydia. So if you have a pre-existing STI, you are likely to get another STI as well. So these are the sort of groups that are likely to get,
and the younger population. I mean, what WHO was talking about between 15 and 49, you know, years. And I think there was also the same concern with HIV as well, among, you know, the adolescents and all those things. Because again, I think for a very long time, especially when we were younger in primary school, would have, you know, classes on the same, and there were very graphic photos and videos that were used. And then over time, it's like the conversation sort of disappeared. We did not hear much about the same. Up until now is when everybody's like, oh wait, this thing's still exist
and still maybe worse than they were before, actually. I think those scary videos were useful.
Listen,
to put people off some things. But at the moment, there's a little bit of something about sexuality that makes us a bit worried about the spread of these diseases.
Absolutely, absolutely. All right. So I know we talked about the cases of asymptomatic, and especially when it comes to women, 75% is what you said. That is a lot. And even from the study by Kemry, they were saying majority of the persons tested were sex workers, and of course the resistance actually came from the same. So then, what do we do? Because we might actually be walking around this town thinking everybody is safe, but really nobody is safe. So let's take a look at the symptoms. But I know that was highlighted partly on Helen Aura's story, but we can look at then, you know, if someone is asymptomatic, then they might not know themselves, so passing it to the other person might be very easy.
I think the main thing would be more like health education about ourselves. If you've had unprotected intercourse, you need to actually be conscious of the fact that you could have had an infection, and frequent testing. So like commercial sex workers actually need frequent testing. Anybody who is entering a new relationship, they have to have that conversation about STI screening, and then have a test before, and maybe a few months into the relationship to see, because some of them may not manifest immediately, so they may manifest a few months down the line. I think frequent testing is one of the best things, even without symptoms, so that we can know, everybody knows where they are. And then limiting the number of sexual partners. That's very key.
There's a lot of stigma around testing. All right. You know, people might be like, I mean, what if I go and then, you know, they find out I have this? There's the question about stigma surrounding the same from a section of health workers and even just the general population in itself. So I think there should be like a total overhaul on our attitude towards some of those things, right?
I think so. And I think there's really a lot of benefit in knowing where you are than not knowing
where you are.
So I think people should be encouraged, and maybe we should make the service more available, readily available. There are tests that you can actually take at home by yourself, so you can actually buy it and then just take it by the quietness of your home. So this should encourage people to take testing more.
Frequent testing, yeah, and it's important. All right, and from the symptoms that again were talked about under the story, most of them sort of like mimic, you know, some of these other infections. And you know, it might be very easy for people to ignore and just say, yeah, I mean, it's just this common infection that I have, and then, you know, take maybe an antibiotic that maybe most likely is not the same. So then how do we distinguish between, you know, an infection that is gonorrhea, the symptoms, and, you know, any other STI?
I think the main thing would be just to be sensitive about how you understand your body as it functions.
Right.
And anything that deviates from that, you really need to think something is going on. You don't have to really isolate whatever gonorrhea yourself.
Right.
That's for the clinician to take the appropriate samples, run some tests, and give you the appropriate antibiotics. That will likely cut away the habit of going straight to the chemist and saying a few symptoms, you know, some indirect symptoms, so that the guy across the counter can give you some few antibiotics. So I think the main thing is actually treat anything that's abnormal as the worst case scenario, so that you can get it all investigated and treated appropriately.
But we don't do that.
That's something
unfortunately. Unfortunately. Where is it that you think we should start, and especially as, you know, as a consultant gynecologist, what is it that we need to know and do and take action, especially when it comes to, you know, our reproductive health?
I think more of it is about information, actually. I think health education would be key in this sort of scenario. That people need to understand what is outside there, the common diseases, their bodies, and what the long-term effects of these diseases are. I think the more we understand about what the diseases can do to you, the more likely you are to seek help.
All right.
And appropriate help, for that matter, not take shortcuts.
Yes, and I think we're culprits of the same, but like we're saying, it's high time we take things more seriously, and especially given the numbers that we're seeing out here as far as some of these STIs are concerned. All right, how about we take a break? But when we come back, we'll really focus on the resistance in itself, and of course some of the practices that sometimes we do to contribute to the resistance. And is it too late?
Not at all.
There's always hope. There's always hope. All right, and of course when we come back, we'll also want to hear from you. Do you have a question for Dr. Miheso? Feel free to go ahead and ask any question as far as STIs and of course the super gonorrhea, which is again spreading around town. So anything that you need to know and understand about the same, whatever concern that you have, again, the numbers are down on your screen, or reach out to us on our social media platforms at NTV Kenya at Lubembe_Winnie. We'll be right back with more right here on Your World. Stay with us.
Own your dream home from as low as 1.98 million Kenya shillings within the popular and rapidly expanding prime neighborhood of Vipingo, Kilifi. Call us today on 0740 400 215.
With Glovo, you have anything you want from your city in your hands. Kama unatamani ugali beef ama fried chicken, order Glovo ujaribu restaurant mpya. Tamu. Kama game inawaka na unataka drinks zaidi, order Glovo ushangilie timu yako. Na kama your little one amemess na diapers zimeisha, order Glovo and save the day. With Glovo, unaweza track order yako na kuongea na customer support, which is always available. Download the app and order anything you want from your city. We'll deliver.
Import your dream SUV with Murray Daddy Motors. Just pay a deposit of 1 million shillings and the balance when your vehicle arrives. Murray Daddy Motors. Over 15 years experience in car importation and over 5,000 cars safely delivered.
Over the course of a long season, even the best teams are not going to always perform at their peak. Therefore, it is necessary to find ways to win on the down days. It is a trait the current Barcelona lineup realizes and is capable of. Manager Xavi Hernandez getting his men to understand the importance of winning ugly. Which was essentially the case as Barcelona beat Atletico Madrid last weekend. Ousmane Dembele's first-half goal and some resolute defending, securing the win and top spot on La Liga table.
Recharge and get upgraded to make memories with your loved ones this new year. Anytime, anywhere. Star Times. Enjoy digital life.
Okay, welcome back. Glad you're still with us. Of course, the show is Your World, and today it's all about STIs and, of course, their impact on the reproductive health. But, of course, we are having a special emphasis on super gonorrhea, which is, again, spreading, and especially here in Nairobi. And the question is, what exactly does it look like, all right? What are some of the symptoms? But, again, Dr. Miheso, just told us something that we really need to think about, and that is the fact that 75% of the women are asymptomatic. You will not know no symptoms at all, but then for the men is what 50% are asymptomatic, right? But then again, so for the ones that will show symptoms, especially for the men, what exactly does that look like?
So we heard from the commentary before, the men will get a bit of itchiness at the on the urethra.
Yeah.
That's one of the first symptoms, and then they'll get a bit of redness and sometimes swelling of the urethra.
All right.
They might get a bit of discharge as well, and the discharge is usually yellowish, greenish, and a lot of discharge actually, very sticky discharge that comes.
Yeah.
Over a few days, the disease starts going upwards, the male genital tract, and they might get testicular pain actually. So for men, it's actually almost limited to those symptoms that are described.
All right. Okay. And we're talking about the question about, you know, the difference between like a viral infection and a bacterial infection, and how sometimes we tend to confuse and take what is not supposed to be, you know, treating the whatever infection that someone has. Can you just take us through that very quickly before we talk about, you know, the impact of, and especially this drug-resistant gonorrhea?
So the best thing when you feel unwell, you need to really see a qualified clinician who can talk through, take a bit of history, try and examine and see what is going on before they recommend any tests if necessary or any appropriate treatment. What often happens in our society, we know it, you skip the doctor, you skip the lab and just go straight to the chemist and say, I'm having a bit of cough or sneezing. The person at the chemist is most likely not qualified, not a clinician for that matter, so they'll give you antibiotics actually. So you end up taking antibiotic for a viral infection, something like a flu. So as we know, after a few days you get better and you think you have actually improved because of the antibiotic. You might keep a few of the antibiotics on the side just in case you fall sick again. So you've taken antibiotics that are completely unnecessary and for a viral infection, and no impact at all. It was going to be self-limiting. Over time, the bacteria or if you have any bacteria, they start resisting the antibiotic you're using. So eventually, we actually start having emergency of strains that are not responsive to the antibiotic, even if it's the best antibiotic in the field.
It's clearly it's not working, and especially now that we're talking, it won't work. Now that we're talking about super gonorrhea. And then something that you said, again, which should be really concerning, especially for us as women, aside from the fact that 75% are asymptomatic, but most of the time you see a lot of women with blocked tubes, which is just sad, you know, in itself. So before we even get there, can we just talk about how then super gonorrhea, or just gonorrhea in general, can affect, you know, a person's reproductive health? Because again, WHO was saying it is extremely cruel to the reproductive health.
Yeah, it is.
Yeah.
So we know that gonorrhea is sexually transmitted, so a lot of times it will be deposited. The infection will actually occur in the birth canal of a woman, in the rectum or in the throat. So the most effects we see are from the infection of the birth canal. So from the birth canal, it will spread upwards. Obviously, the first thing you might see if you're symptomatic is the discharge, which we said was yellowish green. and maybe a bit of frequency. Sometimes women will have a bit of change in their bleeding pattern. Actually, they can bleed between periods or bleed after intercourse. But as the infection goes up the tubes, it causes damage to the tubes, actually. So we see women whose first presentation is actually infertility. They can't have babies. It means the tubes are completely damaged, inflamed, and completely closed. So the egg cannot come along the tube. So that's one of the presentations, complete lack of, they can't have babies, infertility. Sometimes it will be damaged to a lesser extent, that the canal is still there in the tube. And when they get pregnant, the pregnancy can get stuck in the tube, which we call an ectopic pregnancy. When this happens, it actually can be life-threatening. Life-threatening bleeding can occur, and we have had maternal death from that.
Yeah, from ectopic pregnancies, yeah.
So, and then besides that, it can cause a lot of scarring in the pelvis, generally what we call pelvic inflammatory disease. And some women, as a result of this, end up with what we call chronic pelvic pain, which can last for months to years. And we know that it causes early pregnancy miscarriages as well. So there are a lot of huge impact on women's reproductive
health. And then you also said something that, and especially for the women, they might actually contract, you know, the infection after one episode of intercourse, right? But for the men, maybe not.
Yeah, because of the anatomy, the chances of having a man contracting, the risk of contracting an infection after an episode of intercourse is just about 20%, actually. That's 1 in 5. But for a woman, this risk is actually very high, about 60 to 80%. So 4 out of 5 women can actually develop an infection just out of a single episode of intercourse.
Oh, man.
So, that's a little bit to think about.
Yes, something to really think about. All right, and for the men as well, can we just talk about how then they are impacted, if at all they are, especially from the infection?
So men can also get infertility as well, actually. The infection going all the way to the testicles can also destroy the ductal system, the one that transports sperm outside from the testicle out to the penis and out of the system. So they can also get that being damaged, and eventually they can have infertility as well.
Oh, wow. Okay. All right. And the rate of progression, because again, like we said, most of the cases are asymptomatic, so we might not really know. But from the infection all the way to when we see the impact, what is the rate of, you know, progression and, you know, the damage that it causes?
So from infection, most people start feeling symptoms maybe on the 2nd day. So people feel symptoms between the 1st, 2nd, and about 14th day. But in terms of how long it takes to have the complete effects, like infertility and ectopic pregnancy, that varies from one person to another. As we said, you can also have antibiotics for a different reason, and when you do, then that is sort of suboptimally treated, and it can stay for a while. But scarring that results from this is a question of months rather than weeks, actually. So we're talking about months to years.
Months to years, and you might actually not.
You might not even remember when you got it. I mean, most people, we do what we call keyhole to look inside the tummies and find the effects of the disease without them having noted any
symptoms at all. And again, like we said, this is something to really think about, and especially when it comes to our behavior, you know, or sexual behavior again. So and also the question about this drug-resistant gonorrhea, one might ask, so then is it more harsh as compared to just any other infection? Because whatever antibiotic you're taking, it is not working. Whatever medication that you're given, it is not working. So is it more harsh in terms of the impact that one has?
One would say it's more harsh, actually, because you are, unlike the normal one, which you give antibiotics and resolves, this one is not going to stand unrelenting, so it's going to continue with the damage it's causing to the system. So it's more harsh than the one that will respond.
Okay, so the progression again might be faster.
Not necessarily faster, but you are not helping. There's nothing to help the progression, so it's good continuing despite anything else you want to do.
Okay, so then if someone contracts this drug resistant, what happens? That's it? Like, there's no hope? because now the antibiotics are not working, the treatment is clearly not working.
Essentially, that's what it means, actually, because you have nothing to give. So this is supposed to be subjected to research and to try some different antibiotics to see whether they work. So at best, what you can do is to keep changing the antibiotics and hope that one of them is going to work. But at that time, by the time you're doing this, the disease is progressing. So you are really not sitting in a nice place at all.
I mean, listen, this is more scarier than we thought. Yeah. So then the question goes back to then our behavior as people, as you know, human beings, really, not necessarily confined to one specific area. Like we said, this is a global problem. Yeah. All right. So of course the abuse of antibacterial is one of the contributing factors to the drug-resistant strain of gonorrhea. What are some of these other factors that, you know, bring about the resistance?
So abuse is the biggest one. We are giving medications without any whatever. We're not really assessing. We're not giving the right appropriate antibiotic for the appropriate infection. And then the overuse, you said you can keep some of them and just use them whenever the next infection comes and things like that. Yeah. On our market, we might actually have suboptimal quality of antibiotics. We need to actually have some sort of regulation to be sure that what we're using is actually approved and has stood the test of, you know, has been vetted to be good. All right. One of the other things is the microorganism itself. Bacteria, Neisseria gonorrhea, actually in itself can also change. We call it mutation. All right. So it has an inherent way of changing every time to try and avoid the antibiotic. Right. So this is something we can't stop, actually. All we can do is to subject it to studies and try to look for the right antibiotic. So continuous studies and continuous cultures would help you get out of there. And then they also say that the extragenital infections are different from the genital infections. So the anal, the oral ones are different. So the sort of gonococcus you find here seems to react differently when you give antibiotics. One of the reasons is thought to be the fact that they're interacting with different bugs in that area where they are. So they don't behave necessarily the same way the genital ones behave. All right. And how different are they? That you can actually give the same antibiotic that works on the genital that doesn't work on the anal or the throat ones. On the throat, okay. Because they've changed in a certain way that they don't respond to the same antibiotic. All right. Yeah. And the presentation as well, and especially for the throat, because again, like we're saying this earlier on during the break, that some people, you're just walking around with sore throat, you're just thinking, sore throat, I took something cold last night, or maybe I'm developing a kahoma, but really, that could not be the case. So we need to be sensitized to know that oral sex can result in an infection in the throat, take appropriate swabs and get appropriate treatment, actually. Right. So a persistent sore throat, as you're saying, is not going away a few days, and you need to actually think what else is going on. And rather than get the medication across the counter again, maybe get throat swabs, get tested, get examined so that we see what is going on. Okay. So a bit of just being sensible about the symptoms and what else has happened in your life can help. Yeah. All right. So some medication might work on different areas, others might not. All right. Any other thing that contributes to the resistance? I think our main problem is just giving inappropriate selection of antibiotic. We have this sort of infection, we take a different antibiotic that doesn't really work there. So we actually, when we need that antibiotic, it can't work when we want it. Yeah. Or we actually didn't need an antibiotic and we used one. So when we actually need an antibiotic, the one we have can't work on what we need. So a lot of it is just actually our inappropriate use and just unregulated access. We just get antibiotics anywhere. Yeah. You could they even sold on the bus when you're traveling. I mean, listen, yes, and we see that a lot, and we see a lot of people buying without necessarily, you know, understanding what exactly we are taking, and that's a very, very big issue. And then of course there's the question of poor quality of antibiotics. I think you've mentioned that. Yeah. And then they were also talking about you know, low and middle income countries, especially, might not have the right tools either to test or to treat. How much of a challenge is this? I think we mentioned about that again. It's actually a big challenge. I think the high-income countries will have the appropriate... Yeah, it's more like progressed. They have the regulation in place. You can't just access antibiotics. They have the labs in place. They actually monitor drug resistances. So they can actually give, if you give antibiotics, you check whether the patients have responded. If they're not responded, something is not right. to the appropriate antibiotics. So you can recall that patient, take some swabs and change the medication and things like that. Yeah. So the backup of a regional lab, like a research lab like Kemri, helps. And these high-income countries actually have lots of those ones. Yeah. And then, as we said, consultations, again, when you are sick in high-income countries, you actually properly seen, assessed, tested. We take shortcuts. I don't know whether you're saving money, so you avoid the lab, you avoid the physician, you go straight to the pharmacy and hope that you are going to save costs. So a lot of it is where you are, the low-income countries actually have more problems with this. And then when you get the infection, you actually can't treat appropriately. When you get the complications, you can't deal with them. So it's actually one thing after another.
Yeah, it becomes more complicated. All right, then. So then what do we do? Because now the problem is already here, right? There is the spread of, the drug-resistant gonorrhea, for example. There is a lot that needs to be put in place, from, again, access to, the correct drugs and, avoid over-the-counter medication. But let's talk about our sexual behavior as well. What exactly needs to change? Because, again, remember that time there was a whole lot of conversation around condom use, but then again, we got to a point where nobody is using condoms, or there's also a shortage, of the same condoms. So people are like, so then what do we do?
I think protection is the first thing.
Yeah.
Talks about health education. You need to be aware that these things are possible. They're outside here, and a lot of people are walking on the streets actually have it and they don't know. Protection becomes the second thing that you have to think about. A new sexual partner, multiple sexual partners, you have to use protection, and that's actually proven to prevent infections. If you think you've been exposed, then you need to get appropriate tests. So see a clinician, get appropriate testing, and get appropriate treatment. If you're entering a new relationship, you have to discuss STI testing. And we said there are many of them. You mentioned the commonest 4. Yeah. HIV is still a factor. So when you do the initial test, you have to actually wait about 3 months to do the second test, because there's a window period when the changes may not have happened for the test to be positive. So have the conversation about testing, repeat the testing after an interval of time. Okay. And then get the appropriate treatment. Ideally, you should get a test of cure. So go back for a test to make sure that the infection has cleared. So we've got to actually be a bit more aggressive in terms of how we approach this. And I think health education is key. A lot of these things actually out there, the information is out there. There's a bit of something about social media. It drives people the wrong way rather than passing the right message. But health education would actually be, social media could be a strong point, a strong platform for delivering this message. But got to be aware that these problems exist. Appropriate steps have to be taken.
You
think you have it,
And listen, there's some people who, again, might have probably contracted this, and not because they are promiscuous, right? But sometimes there's also a case of rape. There's a case of violence as well, sexual violence in this case. And they're like, so then what do you do? And especially immediately after. I know we talked about tests and all those things so that you get appropriate, treatment. But other than that, so then what do you do in a case of, something like this happens and you're not too sure, whether this person is infected or not?
So again, cases like rape are unfortunate, but what happens, most places like A&D casualty will have a protocol for that. When somebody comes there, they're sensitively taken to a room and the appropriate history is taken. You have to take samples of everything and see whether there's any infection. And as I said, after an interval, you need to bring that same person for tests. So that the off chance that they are infected, we need to actually treat them. There are places where there's sort of protocols where you give an initial treatment, blind treatment, just in case, so that they don't develop the disease actually. So you take appropriate swabs, but still give treatment at the point of contact, and then monitor afterwards. Just in case they...
All right, and you talked about social media and the kind of information that can be spread over there. And I just want us to talk about some of the myths, debunk some of these myths as far as what has led to the resistance, and of course, in this case of gonorrhea. And one person, I actually read this person said, the vaccines that we're taking now are actually the reason why there is this resistance. Right? What are some of these other myths that you've had that you just want to debunk today, especially when it comes to gonorrhea or any other STI?
So to start with, vaccines we don't have any information that vaccines could actually interfere with the gonorrhea or STIs infection as we know them now. And that should actually not be.
That shouldn't. It's not the case. Yes.
But some of the things that I've had women say is that we went for a conference or something and we shared a toilet, and I think I'm now having itchiness. So gonorrhea will not, and chlamydia will not pass through using a toilet, a common toilet at all. So it has to be that intimate contact. And apart from just sexual intercourse, as I mentioned before, you can get infection by sharing toys. So people sharing toys without cleaning. And it can also spread from the mother to the child. During delivery, if the mother has genital tract is infected, and they get actually quite bad eye infection that can lead to blindness. So toilets don't do it. Handshaking doesn't do it. Sharing towels will not do it. So most of the things that we hear outside there are not true. It has to be very intimate contact for you to get the infection.
All right. And of course, the case of mother to child, again, do we have, aside from the eye, right? Is that noticeable, like immediately, or takes a bit of time before? Not long, actually, just days. When a baby is born and there's a lot of discharge in the eyes, redness and things like that, you have to think something's going on. So appropriate swabs, usually antibiotics. It usually responds very well to treatment, actually. All right. Okay. All right. And again, is this common? Because like we said, 75% of women might not know. So, you know, get pregnant, you know, during delivery, and then this happens to a child, and then you're like, okay, what happened? So is this something that you see commonly? Not very, very common, but it's something that we are aware can happen, actually. So babies are usually examined at delivery and examined a few days down the line, and usually this can be picked up. So it's something that we are sort of vigilantly watch for. Because as you said, you might not have any symptoms in the mom. Absolutely, absolutely, and the baby, they might not know. So then can we briefly talk about chlamydia, which again, like we said, is one of the most commonest, you know, STI around of the four that we talked about. So someone might be curious to be like, okay, so does it have any symptoms? Is it something that I need to understand? But before that, we have a caller on the line, Steve from Nyahururu. Good morning. Thank you very much for calling us this morning. Do you have a question for Dr.
Yeah, my name is Steve King Karaoke, and I'm just concerned.
Steve, are you there?
I'm here. Can you hear me?
All right, Steve, we cannot hear you. So kindly speak up so that we're able to get to your question.
Yeah, can you hear me, please?
Yes, we can. Thank you so much for calling us this morning. Do you have a question?
Yeah, I just wonder, I heard the doctor saying that the vaccine is not the major cause of the STI, gonorrhea, and also the HIV and AIDS. But we actually have information that those vaccines were contaminated with HIV and AIDS. And that's why you saw that there were some vaccines that were primarily for Africa and Asia, and some that were for the Western world, is what I mean.
Okay.
Yeah, that one is not just rumors.
Okay.
Yeah, so, Mr. Doctor, can you just explain to me, how sure are you that the vaccines were not contaminated with the gonorrhea viruses and HIV and AIDS, right?
Okay. All right. Thank you very much, Steve. I don't know if you got his question.
I did actually. I don't know whether I can actually reassure Steve from this point. That's a very controversial subject, Steve. I don't know whether you're still there. But the information we have, the vaccines were not really contaminated with anything. So if there's anything that is outside there, I'm not really privy to that information.
Yeah. All right. And of course, again, like you said, there's a lot of mis and disinformation, you know, moving around, you know, as far as the whole question about vaccines and stuff. So it might be nice to just get the correct and the right information, you know, from authoritative sources. Yes, from the Ministry of Health, from the WHO, as well, so that we avoid, you know, several things. We have a question here. This is from, you know, a user on Facebook who says, I think shida yake amesema shida yangu ni tamaa ya madem. What could be my problem? But before you answer that, think about it. Rotich from Eldred, you know, is calling us again this morning. Rotich, it's so good to hear from you. Do you have a question for Dr. Rotich, can you hear us? Kindly turn down the volume of your TV so that we're able to communicate.
Hello.
Hi, good morning. Kindly turn down the volume of your TV so that we can get your question.
Okay, I'm Rotich from Eldoret. I'd like to get some information that Harry was talking about the signs and symptoms.
Rotich, could you kindly speak up so that we get your question?
Okay, I was asking.
That
Harry talked about signs and symptoms, and I didn't clearly get that content.
Oh, you didn't hear the signs and symptoms?
Yeah, can he please repeat it?
Okay, all right.
Thank
you. Thank you very much, Rotich. Dr. Again, just very quickly going through the signs and symptoms we talked about.
So, Rotich, the signs and symptoms are different for men and women. For men, particularly, they get a bit of irritation on the water pipe or urethra. That irritation usually is the first symptom, and then they will get discharge. The discharge usually pass like yellowish green, thick discharge. Over a few days, the infection continues to ascend the genital tract, and they will get pain in the testicles. For women, they'll get a bit of irritation in the water pipe, and this leads to frequency, meaning using the bathroom very frequently to pass urine. They may get the same discharge, which is yellowish green and thick, pass like discharge. They get low abdominal pain, vaginal discomfort, which can also lead to pain during intercourse. Women can get bleeding, which is abnormal, so bleeding between periods or bleeding after intercourse. Over time, as we said, the pain can continue, and the lower pain can actually persist for months to years. And eventually, then the complications now arise, miscarriages, and then blocked tubes and ectopic pregnancies. So the immediate things are just the burning sensation, discharge, frequency of urine, abnormal bleeding pattern.
All right. Okay. And of course, I hope, Rotich, that you've got that. That is all the signs and symptoms that we need to know. But remember, again, like we said when we started the show, Dr. I mentioned 75% of women are asymptomatic and 50% of men as well are asymptomatic. So again, to help us with all this, Dr. I make regular screening and regular checks, our priority,
yes,
because we have this very bad health-seeking behavior. If it doesn't hurt, we don't go to a hospital. And I know we were to talk about a little bit about chlamydia, but I think maybe we can have like another session, on chlamydia in itself. But then again, so how regular should people go for, this checkups, so that we can, avoid some of these things, prevent if we have to, or if one is infected, maybe get the treatment early?
I think the testing is actually not blanket. It's supposed to be targeted. For people in a monogamous relationship and nothing else is new, I think they don't require that much testing. But anytime there's a new relationship or multiple sex partners, this has to be regular, actually. I wouldn't say prescribe 2 weeks or 1 month, but it needs to be regular enough, sensibly regular enough, so that you don't miss an infection.
All right.
For commercial sex workers, these are multiple sexual partners. They have to do it very frequently.
Okay. All right. I mean, there was a study that was released yesterday in terms of men versus women and the number of, partners. I'm pretty sure
I saw that.
You saw that as well. And of course, that clearly tells us something. Like, what exactly is happening to us as a people, to us as a society? It's just like a whole lot of conversation that maybe we need to have. But
that answers that question. The first caller was was saying.
Yeah, the one who was asking. Napenda.
I think that's a personal issue. I think he really just needs to be cautious about what he's doing. Everything you do has consequences, actually.
Absolutely, absolutely. Or maybe there is a problem that they need to,
Can't think of a medical problem.
Get checked. No, I mean, there's a group of people who say, I have like a high sexual drive and I cannot get satisfied by one partner, so I need to have like, maybe several. And there's other one that is a condition. What is that? Sexual. There's a condition.
Disorder.
Yeah, something like that. So maybe just go get checked, right?
That's
see someone and
true.
see
yeah.
and
whether
see
there's anything normal,
exactly.
abnormal.
Yeah, and see what can be done. All right, let's talk to this group of people, and this is the men. And the health-seeking behavior as well for the men, which is very wanting. One might look at and say, 50%, 75% women are more, you know, as compared to as men. So the health-seeking behavior, what is it that you would tell all the men watching us today?
I think the message is out here that there's STIs, sexual transmitted infections, are actually common.
Yeah.
They're symptomatic. We actually all have to dig in and get help when we think we're at risk.
Yeah.
So as I said before, if you are getting a new relationship or you have multiple sex partners, you have to discuss STIs. And a lot of people discuss and test for HIV and ignore all these things. I don't know why, but all of them are equally important. As we've seen, the sort of complications that arise from chlamydia, gonorrhea are huge. So we need to test. Men have their problems in terms of sex, health seeking, behavior. And a lot of times the woman is the one who's going to come and then is asking for antibiotics to take to the man. We'd like to encourage men to also come visit their doctor. You can go to a urologist, get checked, and appropriate tests done, and appropriate treatment given.
No, absolutely.
So it's actually good to see two people rather than one, because it takes two to have a sexually transmitted infection.
That's true. I mean, remember that time, of course, there was a lot of conversation around tracking down, you know, contact tracing. And that became a bit of an issue because, again, so how do you go tell this one, that this one tells the other people would actually hide all the same, In the good countries, actually, the high-income countries, it happens. Yeah. Whenever somebody presents, they have to say who they were with last time, and the other person has to say who they were with, and that actually reduces the spread. So you can actually pinpoint it to the person who started there. So then, what are some of the major challenges that we are encountering here as a country, especially when it comes to contact tracing? Because, like we said, again, most of the time you'd find that it's the woman who go to the hospital. Maybe if something is discovered or they're diagnosed, it might be difficult to go and tell their partner, and then, you know.
I don't know what to say this. I'll be saying my personal feeling, but I think we're not really honest with ourselves. So you really can't tell the story of your life to a doctor because of a lot of things.
Again, there's a lot of stigma, again, like you said.
Maybe that's one of them as well. But I think we need to talk more freely about this so that you actually know where you're starting and where you're going. So you can look back and say, this started from there, and I'm likely to have gotten it from this sort of source. So if you can do a bit of that, actually, in terms of public health, we will likely prevent a lot of these infections.
Okay, all right. And largely, and especially when it comes to investments in, you know, public, and especially in public hospitals, where majority of the times is where we have a big issue, or you know, access to treatment. Like we said, some people might think that you are saving money by not seeking, you know, the correct form of like treatment, and that is diagnosis and all those things, but really there's a problem. So then this says a lot, especially when it comes to like the larger health system in the country. What would you say as we bring this to a close?
Oh, I wish I was in a position to to say something about the system. Because I think the other thing is that these guys actually turn up at the hospital and there's no help. You turn up at the hospital, you are seen, and then you're sent back outside. So you think, well, next time let me just go to the chemist and get it sorted there. And most of the time they'll get better. That's the truth, actually. Somehow some things will resolve and they'll feel better. So I don't know, from the public health point of view, I wish I could actually
be in a better position to speak on the same. Say, all right.
The institutions have to be fully equipped for this sort of things. These are not things that people that queue with the rest of the people. So they have to have a different sexual clinic where they can come and you know, get sorted, and they can seek this help on a Sunday morning, on a Saturday morning, rather than just the standard 9 o'clock
9 to
on Monday.
Absolutely.
So there's a lot we can do about the public health and in addressing this sort of problem.
Absolutely. And we sure hope that that can be done so that we do away with cases of stigma, and this is both self-stigmatization and also, you know, from a section of healthcare workers as well, and just the general population, really, you know, as far as some of those things are concerned. But we have to end the conversation here. Thank you very much, Dr. for coming back today. Dr. Johnston Biheso, consultant gynecologist, giving us all the information we need to have as far as, you know, some of these STIs and what we need to do. And of course, key among them is behavior, because now that we're dealing with a case of drug resistance, you know, gonorrhea, and, you know, so many other STIs that are out here, I think the ball is now in your court. Just stay safe, right? Take care of yourself. Be aware of these things. Go get regular checks checkups, Daktari said, and let's try and prevent the spread of the same. So I hope you've picked a lot from today's conversation, but if you still have more questions, our social media handles, are at NTV Kenya, at Lubembe_Winnie, both on Facebook and on Twitter. Again, we'll forward all the questions to Daktari, and he'll be able to answer them. But for now, have yourselves a lovely day ahead. I'll see you tomorrow morning, same time, same place, right here on Your World. But until then, God bless and stay safe. Goodbye.